Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here today, briefly go over the medication Lisinopril HCTZ and talk a little bit about the uses, the dosage, and side effects of this common medication. First off, what is it? It's a combination product. It's got two ingredients, lisinopril and HCTZ, or HCTZ is an abbreviation for hydrochlorothiazide. The lisinopril is a medication known as an ACE inhibitor. ACE inhibitors essentially cause the blood vessels to dilate. It blocks vasoconstriction in the body. That causes the vessels to relax, and that lowers the blood pressure. The HCTZ is a diuretic or a water pill. It causes the body to lose water and sodium. And so that reduction in the amount of fluid in the body also lowers blood pressure. So it's working in two different ways to decrease the blood pressure in the body. What is the dosage? Well, first off, in the US, it's sold under the brand name Zestoretic, although it's generic and we see most people use the generic. It is recommended that the two ingredients be started separately. You adjust the dose till you find the right dose, and then go on to the combination product. It doesn't always happen that way, and you sometimes see physicians or other healthcare providers start you on the combo. Most people seem to do just fine with that. The lowest dose is the 10, 12 and a half. The first number referring to the lisinopril, the second to the hydrochlorothiazide. Probably the most common dose at 20, 12.5 once a day. And due to the fluid effect or the water effect, this is best taken in the morning, so you're not up in the middle of the night using the restroom. The highest combination dose is the 20, 25. In the literature, suggests the maximum dose to be 80/150. I wouldn't expect to see many people on that. Usually a third agent would probably be added to control your blood pressure before you'd go to that high of dose. But again, that's something you and your doctor or your healthcare provider would have to discuss. So what are some of the common side effects? As a whole, these two medications are really tolerated pretty well by most people. Low blood pressure, we got to watch that it doesn't work too well and make you feel faint or dizzy. Especially be careful during hot weather, as you could get dehydrated and that could exacerbate the reduction of fluid in the body. Dizziness, headache, drowsiness can occur. Rash and increased sensitivity to sunlight, especially that HCTZ portion, can cause what they call photosensitivity, meaning you could just burn easier than normal. The lisinopril portion can cause increase in potassium. Your labs will be monitored for that. Diarrhea, nausea, vomiting can occur. Muscle cramping and weakness, probably mostly due to that effect. The loss of sodium with the diuretic can sometimes cause muscle issues. Cough can occur with the lisinopril portion, and other side effects can occur. They're less frequent than these. Some of the warnings, we need to be real careful. Angioedema, extremely rare, but very important that we notice this, and if it does occur, we seek medical attention. That can happen on the first dose of the lisinopril, and you can get swelling of the head, neck, or tongue, and it can be so severe it causes difficulty breathing. And of course, that is a situation where you need to seek immediate medical attention. And we kind of touched on this before. It can lower the blood pressure so much it make you feel kind of faint or dizzy. So we need to be real careful, especially when first starting. And again, like I mentioned, you want to make sure that you stay adequately hydrated. Otherwise, the effect can be strong. It can affect certain blood cells and cause anemia and different conditions with white blood cells. So your doctor will probably monitor your CBC or complete blood count. Just be part of your regular labs. Kidney function, this can impair kidney function, especially if your kidneys are not functioning very well to begin with. That, again, is something your healthcare provider will monitor. HCTZ can sometimes cause a gout flare, so if you have had gout or have a strong family history of gout, maybe not the best medication for you. Again, that would be a conversation to have with your healthcare provider. They can help determine whether or not this would be an appropriate medicine for you to use. And sometimes it can affect blood sugar. Usually not a big deal, and diabetics often safely use this medication, but just something to keep in mind if you're having if you're using this and you're having some issues with your blood sugar. So thank you for watching my video. Please always contact your healthcare provider if you feel like you're having problems with your medications. You know, you're uncertain about it. You're not sure about something. Contact them right away and see if they can help you figure it out. I'd appreciate it if you subscribe to my channel if you found this information useful. And again, thanks for watching.